Good afternoon and welcome to today's webinar titled Rising to the Challenge, the Role of AI Technology in Healthcare, presented by Healthcare Innovation. My name is David Rath and I'm a Senior Contributing Editor for Healthcare Innovation. Today's program is sponsored by Nuance. We want to thank our sponsors and our audience for giving us your time and attention today. And before we get started, we have a few housekeeping details. To submit a question, please use the Q&A box to the left of your video window at any time. You don't have to wait till the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, you can join the webinar conversation on Twitter, and you can tweet using the hashtag HILiveWebinar. At this time, I'd like to turn the conversation over to Nuance's Chief Clinical Product Officer, Dr. Jared Pello, and he's going to have a discussion with Augusta University Health System's Chair of the Department of Orthopedics, Dr. Monty Hunter, about the role of ambient clinical intelligence in shaping the future of technology in healthcare. So with that, I'll turn it over to Dr. Pello.
Thank you so much, David. I'm really excited to be here with Dr. Hunter. I think just to start off, I'll do a quick introduction. I'll have Dr. Hunter do a quick introduction, and then we'll start going through our slides together. So I'm an emergency medicine physician and have been working at Nuance for the last 4 years. And I'm really excited to talk to you about how I believe AI can work to the benefit of the doctor and the patient. And I'm going to turn it over to Dr. Hunter to do a quick introduction.
Yeah. Well, thank you, Jared, and thank you, David. My name is Monty Hunter. I'm the Chair of Orthopedics at Augusta University Health System and the Medical College of Georgia, which is our medical college here on campus. I've been the chair now for 6 years. I've been at the Medical College of Georgia on faculty going on 20 years now. And DAX has been a huge part of our clinical practice and has made a very positive impact in our ability to see patients and document that experience. And so it's a pleasure to be here with you.
Awesome. Thank you, Monty, for the introduction. Monty and I are on first name basis. We're good friends. So I'll be pulling him in for some color commentary as we go through this. And I just want to thank everybody for taking time out of your day. Hopefully you've got a good lunch in front of you if you're on the East Coast. If you're out on the West Coast, hopefully you've got your morning coffee and your day is starting out right. But part of the reason I love having these audiences is that I get to talk to some of the people that I feel like are the most passionate about what we're working to try to solve. And that's really these barriers to achieving good healthcare experience for both the providers and the patients. And I've kind of bucketed these into 3 separate buckets, going from the operations of the clinic to the provider, and then lastly, the patient experience. And we know that providers, what they want to do is provide great care. And instead, many times they find themselves stuck at a computer station documenting care, working on all of the operational things that need to happen for the delivery of medicine. And because of this, 50% of their time is spent documenting, and they're not great at it. They don't love it. And so there is this loss of revenue, this revenue leakage that everybody knows is a problem. And then there's this provider burnout. And I'm going to tell my story, and then I'm going to ask Monty for his perspective as a healthcare leader. But I know that for myself, after practicing for a few years as an emergency medicine physician, I was already starting to experience this feeling of burnout. And I grabbed one of my partners. His name's Andy. He's a great guy. I love him. And I said, "Hey, Andy, you seem like the happiest guy in our group." And this was, one of those moments in the emergency department where I had like 20 seconds to grab a peanut butter sandwich. And I said, "Andy, how have you stayed so happy practicing medicine in this environment?" And he said, "Jared, every day I have off, I dread coming back to work." And I learned 2 things that day. Don't ask Andy for a pep talk. But the second thing was, he said, those who seem most happy in medicine are those who are trying to improve medicine. And that's another reason I love talking with Dr. Hunter, and I love talking with all of you, is I know that if you're spending an hour in the middle of your Tuesday listening to me, it's because you want to improve medicine. But Dr. Hunter, when you think about operational inefficiencies, provider burnout, what are the types of challenges that you've seen in your clinic and that you've tried to address?
Right. Well, I think to harp on your point, Jared, that was exactly what motivated us to get involved with DAX and Nuance in the first place. We really sort of, when we got submersed in the electronic medical record, we were really thrown in head first. And we're a Cerner, shop, and really it was very difficult to transition. And we had to cut our clinics back by 50% because our physicians, our most highly trained and highly paid professionals, were having to spend all this time as really, glorified data entry clerks. And so we were looking for a way to, one, not only improve our efficiency, but also provide a better medical record, because we're not good, data entry clerks. We don't put information in. And it really took away that personal interaction with our patients. And, I had, several doctor's appointments where my doctor never really had touched me or examined me. He had his laptop in his hands and really was more at the keyboard than with me, the patient. And we were seeing that in our practice, and it was really a big dissatisfier. And then moreover, our clinicians were finishing their day in clinic and then not really completing their notes at the time, and then having to spend time after clinic and in their own personal lives to go back and provide the documentation, or the dictations, or however they came at that point. And so we were very fortunate to find DAX, and that really, out of all the things we've done as a department, that is the one thing that I think has been the biggest satisfier, both from a professional and a personal standpoint for our faculty and for me personally.
I love that you pointed to a few things there around, it's really difficult. This whole digital transformation of healthcare has been really hard. And I feel like we're getting to a point where we're starting to have tools arrive on the scene that it's making things better. And then that whole patient experience, the interesting thing about healthcare is even physicians are patients. And so, if I were a mechanic, I might not take my car to another mechanic. I might just fix it myself. But as a physician, I'm going to go have those patient experiences as well. And I've had that same experience with my physician, not even really looking at me, working on the health record instead of me, and just thinking this can't be the right way. And so we know that that's not just, Monty and my experience. 75% of US consumers say that they wish that experience was more personalized, and that 61% of patients say that they'd go to their healthcare provider if they felt like the communication was better, if they felt like they were really connecting with their physicians. And so at Nuance, as we kind of work to figure out how do we solve this problem, what we came up with is something called Dragon Ambient Experience. And you'll hear Monty and I both refer to it as DAX. And it's really the ability to capture ambiently, and when I say ambiently, just something is recording and listening to a doctor and a patient talk. It's the ability to capture that conversation, and we want that conversation to be as conversational and as free-flowing as it could possibly be, and then have the clinical note just be written for you. And we launched this in 2020 at the beginning of the pandemic, and which you would think would be the worst timing ever. But what was interesting is I feel like it really gave us the opportunity to see the outcomes in the hardest of circumstances. So I'm going to share a little bit about some of these outcomes that we've been able to see, and then I'm going to ask Monty for some of the outcomes that he's seen. And I know that my partner who helped me create these slides, I'm probably messing up her whole flow because I'm going to have Monty talking about some of this stuff early. But I really want to get his thoughts as we move through this, because when you look from left to right, again, trying to bucket, operational efficiency, physician satisfaction, and then patient experience to address those obstacles that we were trying to address. And we found that providers on average save 7 minutes of time per patient. Now that could be less. If I only spend 4 minutes seeing a patient, it'd be crazy if it took me, 14 minutes to document their care. But across all specialties, that is the combined average that we've seen, is 7 minutes of savings. And most providers, when they start using DAX, they're not necessarily always looking to add patients. And we've seen this time and time again, where a provider starts with DAX, and after starting to feel like a real human being again, after like 3 or 4 months of using DAX, they go back to their administrators and they say, hey, I'm kind of sitting around in clinic. I've got free time. I'd really love to add some more patients. And so we see this average of 3 to 5 additional patients added. And then this section on physician satisfaction, I mean, that's, to me, there's 2 things that I'm extremely passionate about. Number 1 is great healthcare and patient experience. And number 2 is helping my partner physicians work in an environment that they feel like they can continue to serve us in. And so this 93% of physicians who would be disappointed if DAX were taken away, and 9 out of 10 who would recommend DAX, and a 70% reduction in feelings of burnout. To me, those are just amazing. And so I'm going to stop right there and bring Monty in and ask Monty, what were some of the outcomes that you guys saw around kind of operational efficiency and physician satisfaction?
Right. Well, the first thing, in a contemporary orthopedic practice, we're a high volume, high throughput service, and we have a huge demand for our services. So when we had to cut back our clinics volumes by 50%, it was a huge impact on, one, patient access, but then also for the finances of the department and the health system. And so it was a huge impact on a lot of things. And as we got comfortable with DAX and as we started using more, we quickly were able to ramp back up to our full patient volumes, which on average for most of it's about 20 patients in a half day, maybe 24, 25. But I think, as you were alluding to, if there was an add-on patient or someone called in and needed to be seen, nobody had any hesitation about seeing that extra patient, because it was really just seeing the patient. It wasn't all that extra administrative work and burden associated with that visit. Mm-hmm. And so we were able to quickly be a lot more efficient. For me personally, and I think my colleagues would say the same thing, it put the fun back into being a doctor and being in medicine. You got to concentrate on your patient and talk with your patient, look them in the eye, and you're involved in the clinical experience, not just the computer, the electronic record.
I love that. I remember early days, one of my favorite summertime pictures was a physician with their family at the lake saying, because of DAX, I get to be spending my weekend with my family instead of with the charts.
Yeah. No, one of my colleagues, a mother of 3 young girls, she would spend her day in clinic and then prior to DAX, obviously try to get through the clinic volume, go home, take care of her girls, put them to bed, and then start her charting and be up until midnight and beyond. And, that's just not sustainable. And so DAX really has made a big impact in all of our personal quality of life, much less our professional quality of life.
Yeah. And I think as you can hear from what Monty and I are kind of explaining, there is a definite ROI just from increased patient volumes. And as you see in that third column, there's kind of 2 places where I'll speak to the return on investment for DAX. And one is the documentation quality is higher. 80% of physicians believe the documentation is better than what they produce themselves. And that $18,000 of incremental orthopedic revenue, those are real world numbers. And we work with our clinics, clinic by clinic, to show what that ROI potential is for you and your clinic. And then that last column, just hearkening back to that patient experience. if I could say, at the end of the day, my patients feel like I'm focused on them, that I'm connecting with them, more conversational, and spending less time on my computer, that's exactly the kind of outcome. Dr. Hunter, what's the feedback been from your patients?
So the feedback has been universally positive. When I go into a room now, I go in with my iPhone, and I just mentioned that if it appears that I'm talking to somebody else in the room, it's because our conversation will be recorded, which helps me get the information in the medical record. And no patient has ever opposed that, and they think it's pretty cool technology, to be honest. We've only had one patient in a practice, and the physician really didn't mention it at the beginning of it, and it just caught the patient off guard. And they mentioned they just were caught off guard by the fact that our conversation was recorded. So now we are starting to put in, when a patient signs up at the front desk for care, there's a paragraph in that note just saying that we use the DEX technology, and most of us will just make sure the patient's comfortable with that. Patient's uncomfortable, I think the beauty of it is you can stop the recording and then use it as essentially a dictation after the patient visit is over. You can leave the room and dictate your visit as we used to in the old days when I first started with a little dictaphone.
Right.
Yeah. And so there's very little difficulty in making that transition.
Yeah, it's been so interesting, in an age where privacy and security are utmost concern. We've found over and over again, patients care, yes, about privacy and yes, about security, but what they really care about is the kind of care they're receiving from their provider. And like you said, almost every patient is willing to consent to be recorded so that they can have their doctor's attention on them.
Yes. And, I get asked, is everything recorded or transcribed? And like I point out to my colleagues, and you and I have talked about this, we've got a lot of patients that I've known for a long time. And so when the conversation strays to NASCAR or the Masters, depending on the patient's background, of course, none of that is part of the electronic record. All that is, gleaned from the note. And it really does, the note is a very thorough, accurate representation of the patient visit. And from the financial standpoint, two things that we've noticed is one, we get our notes done much faster, of course, so it gets into the revenue cycle that much quicker. And because the notes are more thorough and complete, we haven't been able to quantify it, but certainly with a more complete note, it's back in the prior coding, it allows us to upcode significantly better.
Yeah. Yeah, I think it does. It's so interesting. You think you're solving one problem, and there's all these other things that kind of add on as you solve that problem. As a provider doesn't have to worry about their documentation. I mean, we've worked with providers that are 600 charts behind.
Right.
And it's crazy to think they can remember those facts. And so capturing the documentation at the point of care is definitely going to give you the best record. Higher quality, more audit proof, all of those things, better pre-authorization, all those things are going to come with better documentation. Yes. I'm not going to speak a long time to this slide, just pointing out that when you add up 7 minutes per patient, it really adds up. And probably for Dr. Hunter and his team, it's probably not 7 minutes, but 2 or 3 minutes per patient. And if you're seeing 40 patients in a day, that could still be 2 hours where, the one colleague that was putting her kids to bed and spending a couple hours every night, she gets to save all that time and not be stuck with that.
Yes.
The next thing that I want to just touch on is lots of times we think about burnout as really it's just a provider wellness, like just a happiness thing. But I think we're seeing better and better science of the true cost of provider burnout. And if you go to the AMA website, and you can see the link here on my slide, it'll actually help you calculate what is the true cost of provider burnout for your organization. And we know that providers who are experiencing burnout are twice as likely to make a medical error in the next 3 months. And so it's not just a provider wellness, it's really a patient safety issue. It's a patient care issue, and it's a retention issue, a recruitment issue, all sorts of things. for keeping those providers doing what they felt called to do. I'm curious, Dr. Hunter, if you tried to take away DAX today from your providers, what do you think would happen?
It would not be pretty. So I'll just tell you two things. One, it's been a huge recruitment tool. When we've recruited some of the top orthopedic surgeons, we've got a fantastic faculty with us, and that's been a huge part of the recruitment. When they hear what DAX brings to their clinical experience, it really has made a positive difference, and has helped us land some of these folks who've had great options at many places. And then, secondly, every year when budget season comes around and our hospital and health system administrators are looking for ways to cut cost, they're looking for at every expense. When this has come up, we've had a couple of people say this would be a deal breaker. If you take DAX away from me, then I would consider my options somewhere else, I think, honestly. Yeah. So.
Yeah, and that's a good one to point out, because we know that just to recruit a highly talented orthopedic surgeon, the lost revenue from not having them, and then to recruit them, it's going to cost $1 million to a health system.
Right.
And so well worth the price of admission. Mm-hmm. The last thing that I want to talk about before I go into the details of how DAX works and probably answer some of the questions that are coming in is that at the University of Michigan Health West, we saw this amazing adoption of DAX and what it did to their patient wait times. And so you can see that pre-DAX, they weren't terrible. 20 minutes in the waiting room is not the worst that you're going to see out there. But they were waiting for 20 minutes. And after 6 months on DAX, their patients were spending an average of 4 minutes in the waiting room, which I think all of us want that kind of efficiency for our patients. We want them to spend as little time at the front checkout desk, as little time in the waiting room, and as much time with the doctors as possible. So I'm going to talk about how DAX actually works. So I talked about capturing the audio. And there's two ways to capture the audio, and 99% of them use that iOS device that you see on the left. So use an iPod or an iPhone, and you've got a DAX app, and you have a patient schedule. You select that patient, and you can give any kind of preamble for that patient before you go in and see them that you want to. And then you go in and see that patient. And you'll see on the bottom part, there's that capture, the under encounter, which is the capture of the patient and the provider. And that, when I say patient, it could be patient and entourage. It could be, spouse, child, it could be several different people. And we're capturing the audio from all those people speaking in there. Well, once that audio is captured, it goes through the Nuance AI cloud. And the first step is what we call speech diarization. We separate out all the speakers into their own transcript. And then we send it through our natural language generation AI cloud, and that generates the clinical note. And if you haven't seen a demo of this, you should really go to our site, and there'll be a link at the end where you can go and request to see a demo. And it's almost like magic to see this natural conversation happen and then see this AI note get produced. But we've learned a couple things. One is doctors, they don't want to spend time editing that note. And it takes us a while to get that note good enough that you'd ever want to show it to a doctor. And so we have a quality reviewer who does all the editing for the doctors and gets that note as close to 100% as possible. And then that note gets placed into the EHR for the physician. And it's right there to be signed off. It's not as a PDF. It's right in the EHR as if the provider had written the note. And we have close partnerships with Cerner and Epic and Athena and all the major EHRs, and working on integrating this more and more deeply into the provider workflow. And then the last thing I'll mention about this slide is we do have a native Microsoft Teams integration where it's as easy as clicking a button in Microsoft Teams, consenting your patient, and recording using DAX. And this next part, I'll bring Dr. Hunter in here in a second. When COVID first happened, there was a lot of telehealth. And some telehealth has stuck around for some of our clinics, not nearly as much. But one of the things that we learned right away is, although the mobile app hadn't specifically been built for flexibility in capturing telehealth as well, you could use the mobile application to capture audio from the computer and from the patient or from the physician. And you could do telehealth visits on any telehealth, any video platform at all. Dr. Hunter, when COVID hit, how much of your system had to move over to telehealth for some period of time, and was DAX able to kind of handle that for you?
Yeah, we did. Several of our providers moved over to telehealth, and it's remained a big part of our practice. And we have a couple of specialists who have consultations from all over the country, telehealth, or they send their MRIs in for review, and then now we can have a telehealth visit. And DAX works effortlessly in this situation. You just basically use it as if you would a patient visit. You put the patient modifiers in, start the conversation just as we're having, and DAX records that conversation and generates a note from that, just as if you're on the clinic visit. You just won't have a hands-on physical exam.
Right. Yeah, it was somewhat remarkable to us. Mostly, I'm just super impressed by my research team and their flexibility and their ability to tune, audio from a computer into a phone and train the AI on that. But it was a welcome salve for all of our providers who went through this rapid change from in-person to telehealth. And telehealth will only grow as we continue to learn how to use it better and better.
Yeah. Well, because orthopedics is such a manual, hands-on, specialty, a lot of our providers were reluctant to get involved in telehealth. When they found DAX could come with them, it really changed the attitude about people participating.
Yeah, totally. One of the interesting things that, as we started DAX, one of the things that we realized quickly is DAX needed to write notes better than providers could write on their own. And so we really have worked with partners across medicine, including the AMA and HDI and CMS, to make sure that our documentation meets compliance standards and coding standards, and that we deliver a high quality note that looks like it was written by a physician. And one of the things that I think is really cool about DAX is you can imagine some sort of computer that could click template fields for you and make a really poorly written list of facts that you couldn't really tell the patient's story from. But DAX actually uses natural language generation and writes the note like a human being. And it does it really well. So we've gotten to the part where I'm going to turn it over to Monty to tell a little bit more of his story around their adoption. And Monty, you don't need to feel like you have to cover things that you've already covered in our conversation, but I'll pull your slides up and turn it over to you.
Very good. Well, yeah, I've been tremendously impressed from the very start and how good a note DAX generates. I mean, it's a note way better than I would come up with if I were just dictating a note or putting a note in. And so it's been remarkably good and complete and thorough. And I think the other really positive thing about it is if there's an issue with the note, or if the clinical documentation specialist doesn't understand what's said or is not really completely sure what's happening, then I am sent a note via email or attached to the document asking those questions, so I can correct them on my own, or I can basically redictate a note or add that information to it. I think the other thing that DAX has really done that's helped us tremendously is, we do a lot of office-based procedures, if it's just injections or what have you, and the conversations you have over, preoperative, risks and benefits with things. And so, historically we've said the same things over and over again repetitively. And so with DAX, you can put together all these pre-completed notes or templates, and then just ask your scribe to include the pre-surgical discussion, or however you want to title it, or the right knee cortisone injection with Kinalog, and boom, a complete note is generated with a full, procedure information included in it. And so it's just really adds a tremendous factor of efficiency and completeness to your notes.
Awesome. So, Monty, I have up your slide about Augusta University Health, and I'll let you tell us a little bit more about you guys down in Georgia.
Yeah, well, no, certainly. So Augusta University Health is the health system on campus. So the medical college is the Medical College of Georgia. It is soon to be the 5th largest medical school in the country, and it's part of a huge health sciences campus here. And the Medical College of Georgia is the only public medical school in the state of Georgia. Augusta Health Sciences University and the health system, we're a large level 1 academic center or level 1 trauma center. All of our physicians are subspecialty trained in orthopedics. All of us are fellowship trained in our particular specialty. And so what makes us different from a community hospital is not only, we take care, our shoulder doctor is going to take care of your shoulder. He's not going to do a wrist one day, a spine one day. He's going to, take care of your shoulder. He's going to provide the best technology and the best care that is possible for shoulder care. And he's going to be pushing the envelope to improve those techniques, improve the technology, involved with care. And so all of our physicians, have that, their area of subspecialty expertise. And then we obviously, our missions include not only the highest level of cutting edge technology and patient care, but we also are involved in teaching residents and medical students. So we have a residency program. We have 4 residents a year. It's a 5-year program. So we have 20 residents in-house at any time. And then along with that, we have the medical students who rotate with us. We have physician assistant students, nursing students. And so, all aspects of health care are trained here on the health sciences campus. And of course, teaching the latest and greatest technology, includes, the ways to be efficient in clinic and provide, efficient, effective, cutting edge clinical care. And so in our, as I said, we have 4 physicians a year. We had over 800 applications for those 4 resident physician positions last year. So we're very fortunate to have, the best of the best that come to train here.
That's really great. Not only is it a beautiful location to practice medicine, they get to work with some of the top physicians in the world. So,
right.
And I think one of the things you pointed out is that not only do they need to learn medicine, because medicine, yes, the practice and care of medicine is really important, but you also have to learn the business, the efficiencies, and all of those things. And I think DAX is a wonderful way to teach them both things. How to focus on your patient and how to be most efficient.
No, absolutely. I think historically we've not done a very good job in teaching our young physicians in training how to be effective in the world and be efficient and worry about costs. And, patient care is first and foremost, but how you do that in an efficient and effective manner. And I think it's our obligation to teach them that, because this is the world that we all live in now. And I think people sometimes don't understand that even though our mission is trifold, meaning patient care, education, and research, we have to be that much more effective and efficient in providing effective patient care, which helps drive the academic and research missions.
Yeah, no, you're exactly right. If all you do is publish great papers, but your patient care isn't top notch, it's not going to be the same.
Yep, exactly.
Yeah. And obviously it's been a wonderful partnership with Augusta Health University, with us at Nuance. And one of the reasons that we believe Nuance is well positioned to help solve this problem, continue to solve it in healthcare, is because of these deep partnerships. And we have this deep healthcare expertise. PowerScribe is used by almost every radiologist in the US. And Dragon Medical One, over half of physicians, over 500,000 physicians use Dragon Medical One on a daily basis. And so there's this really deep healthcare expertise. We're not a technology company that's trying to get into healthcare. We're a healthcare tech company, and it's in our DNA, and we really care about the clinical workflows and how to fit in there. That AI technology is super core to who we are. Since the 90s, we've been on the cutting edge of speech recognition and building out some of the first neural nets on the planet. And then that last difference is really the ability to have deep partnerships with our EHR partners, where you just don't have any old company walking up to Epic and Cerner and being able to have the kind of collaborative partnership where you can solve really technical and real clinical problems together. And these are some of the reasons that we believe Nuance is best positioned to help solve these problems.
Mm-hmm. Now, well, first and foremost, the technology is outstanding, but really what has built our relationship are the people involved. And Nuance is not just a technology company. I mean, it's been a group of people that have been with us and have met our needs, have listened to our problems, and really worked on solutions to help us be more efficient and effective. And, when we have a new provider, or when we all first got started, any new provider that comes on now, we've had, experts at our elbows teaching us, showing us how to do this and use it effectively. And then even now, we're 7 years into this relationship, but we have still once a month, call-ins and meet with a group of people and troubleshoot, discuss any problems, what's working, what's not working. And so that relationship has just grown, and it's really been that sense that you guys are trying to help us provide the top level care and help us achieve our goals. It's made this such a great relationship.
Oh, thanks for pointing that out. We want to think of ourselves as your partner and just like right there with you in the trenches and trying to solve these problems for you and your patients.
Right.
One of the last things I want to talk about is that we recently became part of Microsoft, which is so exciting for me because Nuance has this tremendous potential to affect care in the United States. And with the addition of Microsoft, I believe that our reach can be even more global, more universal, and more impactful. And with the speed with which we can develop our AI and our technologies is only going to increase. And then we have deep partnerships with the AMA, Epic, Meditech, Cerner. And so at this point, we're just about to question time. I'm going to turn it over in just a couple minutes. But I just want to talk about what we've seen from different clinics on how they use that time savings from the physicians. And so if you look at this slide, what you'll see on that first bar across the top is the current process requires a lot of documentation time spent by the physician. And with DAX, that documentation time shrinks vastly. They still have to review the note. They still need to make sure it's accurate and sign off on it. So it's not zero, but it reduces vastly. And as I mentioned previously, what we've seen over and over again is as providers start using DAX, as they start to feel like real human beings with lives outside of the clinic, then they're more willing to add more patients. And so that's what you see in that bottom line, is that the number of patient visits actually increases, but the amount of time they spend in their day is actually less in clinic and less working on work outside of clinic. So if you're ready to learn more about DAX, please go ahead and go to nuance.com/ambient and come see one of those demos. I think you'll be blown away by how cool it is. But with that, I'm going to pull David back in and move into the questions.
Hi, guys. That was a great presentation. We have a lot of questions lined up here, so let me start on them. The first is, would you speak to the security and privacy safeguards to using a recording function on your iPhone?
Yeah, I'll speak to that, and then I'll let Monty answer if they've had any concerns. So it's all encrypted. From the second you hit start, it's being encrypted. You can't play back anything on your iPhone until it's in the cloud. So once it gets uploaded to the cloud, you can stream audio, but it's never sitting in a playable form on your device. So that's how we keep that completely locked off to anybody that might get access to the phone. So, we've had providers lose phones and things like that, but we've never been worried about the ability to keep the PHI for our patients safe. And of course, there's passwords and PIN numbers and facial recognition to help all of this be as secure as possible. But Monty, anything you'd add to kind of security stuff?
Yeah, no, the only thing I would add is that, of course, when we started this relationship, of course, our enterprise was very concerned about that and HIPAA compliance and all of those issues. So this was very, very deeply vetted throughout for its privacy issues. And it's not been an issue for us either for exactly those reasons. It's all very encrypted. And I'll just say the only time I've been concerned is when I've left the machine running. I've been called out of a room. I've had to have a private conversation with somebody while the machine was running. And actually, the clinical documentation specialist called me at that time and said, you might want to turn your phone off. We'll just, basically make sure that conversation is not, basically it's done away with or erased.
Yeah.
So.
Yeah, and I will point out we are high trust certified, so kind of through the strictest and most stringent security measures to make sure we keep everybody's data safe.
Right.
Okay. The next question is, does every patient sign an acknowledgement that their visit is being recorded, and is that recorded in DAX?
So Monty, why don't you speak to what you guys are doing, then I'll speak to what Nuance kind of requires.
Right. Historically, we've used this verbal consent, and anybody who's objective, but like I said, we turn the machine off. That's been very, very rare. We are going to add a clause under the statement when you consent for care. That will be part of the acknowledgement, but that will be in a paper form at the front desk. And we'll still use the verbal acknowledgement just to make sure people are aware.
Yeah, and that pretty much covers it. I mean, we do require that everybody do at least verbal consent. Mm-hmm. And verbal consent is usually done before you actually start recording. So you're going to tell the patient that you're consenting them. Usually clinicians will say something like, hey, I've got an app that's going to record us speaking so that I can pay attention to you and not worry about my documentation. Are you okay with that? Patient says yes. And then the doctor just goes ahead and starts. So we rely on the doctors making sure that consent is captured. Different health systems have done it differently. Like Dr. Hunter said, they're adding it to their form at check-in. We've had some who require that and others who stick with audio only or verbal consent only.
Okay. The next question is the product more geared specifically for specialty physicians, I guess, as opposed to primary care? Is there a difference?
Monty, you want to answer from your perspective, and then I can talk to.
Sure. It works beautifully with specialty physicians in orthopedics. And, one of the things I get asked about is, how do you do your physical exam? And so one, I usually have my recording device sitting, on the table where I can pick up information, and I'll talk through the exam. I'm a knee specialist. I'm a sports medicine physician. And so I'll just really talk through the exam as I'm doing it. And, the patient typically understands, and then all that's recorded by the clinical documentation specialist. And so, like I said, it's just a very seamless, easy, efficient thing. You leave the room, your note's done effectively.
Yeah. And the question about, would this work for primary care? The way that we onboarded onto DAX was we started in orthopedics only. It was the only specialty we did for some period of time. And when we went generally available at the beginning of 2020, it was only 5 specialties. Today, it's 32 specialties, and our fastest growing specialty is primary care. We're adding, hundreds of primary care providers this year. And so I think that this is, I haven't seen a specialty yet where it doesn't really work unless you're a pathology or radiology, where what you need to do is just really dictate. And then we have other products for that. And so primary care, absolutely, we're just seeing a huge benefit in primary care. And actually one of our main sites that is kind of widely adopted us, they're doing it only for primary care because they've seen such a return on investment. So absolutely, primary care is a great specialty to use this.
Great. The next question is, where is the actual recording stored?
Yeah, so it's stored in our Azure Secure AI cloud. And of course, it's all behind security. So super safe, super encrypted. So that's where it's at.
Okay. The next is, how does DAX differentiate between the different voices, and what content is clinically significant?
First, I'll turn it back to Monty. You kind of mentioned this. You have some patients that you may know well, but I'll let you talk to parsing out what's clinically significant and not.
Yeah, well, no, exactly. I think the value is you can have a conversation with your patient. Of course, in the course of the personal history, you're going to ask pertinent questions, and your clinical artificial intelligence and your clinical documentation specialist backing that up really gleans the pertinent positives out of that. So anything that's not of a clinical nature has never been included in one of my notes. And believe me, we get off on some pretty far tangents sometimes. And but I think it allows you to have that freedom to just talk with your patients and be a provider with them. And so it's not really been an issue as far as any excessive or accessory information. And if there is, you have the opportunity to edit that note when it comes back in your queue. And at this point, I've worked long enough with the system and with our documentation specialist that I really seldom have to edit or alter a note.
Yeah, the way that we do it, a couple different things. The differentiating the speakers, that's nuanced research doing amazing technology and figuring out how do you isolate speakers from one single audio stream. And recognize them as distinct speakers and get those clean transcripts. Number two, how does it glean clinical relevant information? It's because people like Monty have been using us for years. And so we've captured these really rich conversations that are free roaming and go all over the place. And then we have a final clinical note. And so the AI has been trained on this really natural conversation and knowing, if Monty mentions that he nearly had a heart attack during the Duke and UNC game, it knows that that's not clinically significant unless he went to the ER afterwards. Right. And if Duke had hit that last shot, he maybe would have.
That's right. Exactly.
But yeah, it's really it's remarkable how good it is at knowing what's clinically relevant and what's not.
Right. I'd like to add one thing. We have pediatric orthopedic specialists, and so our providers will go in a room, and of course there's a mom and a dad and a child, and oftentimes the child can't speak for itself. But even if it's an adolescent and the child or the patient is speaking and the mother or father adds something to it, the clinical documentation specialist will just add, mother added that the patient has had this symptom or has been doing this for whatever. It's been remarkably thorough and accurate in its ability to add different information from different voices.
Yeah.
This is a question that Monty touched on a little bit maybe, but the person asks, what role does the Augusta Health HIM department play in the use, training, and management of DAX data, if any?
Yeah. Well, so basically, they we do the notes come back through the health information management system and will show up on the electronic medical record. And so once this has all been vetted, they're really out of that clinical process. If there's a problem, the problem is with us signing our note or completing our notes or monitoring what notes need to be done. And so other than that, they've not had really much other involvement in the day-to-day management other than making sure we've got a complete note and signed off on.
Okay. Another person asks, how accurate is DAX? Is it 95% accurate, 99%?
Johnny, I'll let you go first.
Okay.
I'm sorry, you're like, you know, I would in the high 90s. You know, like I said, very seldom do I have to alter a note. Now, of course, in orthopedics, particularly subspecialists, I'm doing knees. You know, each of my clinic visits revolves around a knee, so we sort of polished this process to where I basically glance at the note, make sure it's got what I need, and sign off on it. So high 90s, 95 to 99%, just a hedge, because nobody's perfect yet.
Yeah, and I would say it depends on several factors, and Monty called some of those out. How complicated is the patient? How long is the visit? If it's an hour-long visit where most of that was just chit-chat and not medical, then it's going to be pretty accurate compared to an hour-long new patient pediatric seizure that there's a lot of clinical content in there. And even then, though, what you're seeing is the provider editing, so they don't have the cognitive burden of needing to remember everything that happened during that hour-long visit. They just need to read over and make some edits. So even 95%, 5% change might seem like a lot, but it's a whole lot faster than creating that whole document from scratch.
Mm-hmm. Yeah, and the clinical documentation specialist, as I mentioned, if there's ever an issue, something's not understood, or they didn't understand what I was saying, or the test we were doing, I get a note in the queue addressing that, and then I can address it or edit it in the note.
Mm-hmm.
Okay. Another question is, how are you thinking about integrations and standardization as all digital healthcare platforms move closer to a complete healthcare profile for both the team of physicians, for one patient, or for the patient themselves?
That's a really good question. And the way we think about it is we work really closely with our EHR partners. And so I'll give you a little bit of insight into how we think about just standardization of the clinic visit. We try to enforce and train our providers to all do problem-based assessment and plans. So call out your problem and call out the plan for that problem, call out your next problem and call out the plan for that problem. As we know, problem-based charting hasn't really caught on for some reasons, and that's because of the IT lift of a provider needing to go find that ICD-10 code, document it in a weird field in the EHR. And we're working with our EHR partners to really make that smooth and seamless. And one of the outputs of that is going to be a really great longitudinal record of that disease state for that patient. Something that hasn't been able to be achieved with our current tools out there just because of kind of the clunkiness and the user experience that currently exists. And so that's how we think about it, is we think about these really close relationships with our EHR partners, and then how do we communicate those things out to our providers who need to be trained in how to do things. And then other ways of standardization, what we've found over and over again is it's not so much the content of an exam that needs to be standardized, because then you get into the area of trying to dictate care of that patient, how the provider practices medicine, and that's not what we want to do. But it's more in the generation and the capture of the data and standardizing that in a way that it can be useful for the healthcare system, for the provider, and for the patient down the road. So that's kind of how we think about those integrations and standardization.
Okay. Another question that's come in is, how well does this perform with patients who have English as their second language?
Monty, you ever run into that?
I personally have not. However, I can see if oftentimes we have had to have interpreters that we call and prearrange that visit. And so, again, it's just part of the natural conversation. So you can ask the patient a question. If they answer in another language, the interpreter would interpret that. It would be captured by DAX, and a note would be produced. So I don't see that as really being an impediment or a change in workflow at all, other than the interpreter being involved.
Yeah, so for not having had experience, you answered that question perfect. That's how it works.
Another question is, what is typically the cost structure for physicians in hospitals?
It's all different. So we see some hospitals that use this as a recruiting measure, a satisfaction measure for retaining physicians. And then we see others where there's some cost sharing between the physicians and the healthcare system. We see the broad range of it. So yeah, I don't know. How do you all do it at Augusta?
Yeah, well, I'll add to your point that several of our residents who have finished programs, when they negotiate contracts with the groups they're going to, insist that DACs be part of the contract, and so it's been remarkable. They understand the benefit of it. We basically have a contract, and it's negotiated at the health system level, but it's really basically based on volume. We have super users, people who see a lot of volume, and the more volume you see, as in a lot of businesses, the less you may pay. But there are different tiers based on the level of patients you see and how much you use DACs.
Mm-hmm.
This might be a question for Monty. Do you have to change your workflow with DACs at all?
I would say yes, but only for the better. I mean, the workflow now is just so much more efficient. So basically, I go in, I see the patient, the clinical visit is documented. When I come out of the room, I may add a little summary statement if depending on the visit, just add a summary statement at the very end. So the final diagnosis was this, the plan will be this, and then your clinical documentation specialist will sort of marry that into the note that's set up like you want it to be set up. The other thing I would say is, one thing's in orthopedics, if I go in and start a visit and then you tell me about maybe your shoulder hurts as well, let's get an x-ray of your shoulder, then you just basically mention, we'll delay the visit from here. We'll pick this back up when the x-rays visit. So you close out that documentation. You go see another patient or two, complete those notes. And then when you come back to the patient, once they're back from x-ray, then you just start, this is Mrs. Smith, her medical record number is this. We're going to complete the visit from where we left off before she went to x-ray. And then because of the clinical identifiers, your documentation specialist will marry those two visits into one.
Okay, we have time for one more question. Are documents published to the EHR in a pending or finalized fashion?
Pending.
Pending, yes. So I'm the only one that can finalize my note. So it's sent to me, and I review it, and I sign off, finalize it.
Okay.
Once I sign it, it's mine.
Well, we're almost out of time. Any other last comments you guys want to make? This has been a great conversation.
Monty, anything from you?
Yeah, I think I've hit on all the highlights. Like I said, we've been such users of this. It's a part of our everyday practice in our life, and our Nuance partners have become good friends and colleagues. And as you mentioned, Jared, they've become very much partners in this journey and continue to help us. I would say there are three things I'm looking for in the future. One is that based on my conversation, we look for an order panel. So by the time it gets to I get out of the room, our nurse can hit all the orders that we talked about in the room. For example, we're going to do an MRI scan, physical therapy, and we'll see you back in a week. Boom, hit the button. The second thing is I'm looking forward to the time when you help me with coding and billing, and you can put that together. And third, I think if we can do this in the clinic, we should do it in the OR. If I could do an op note that I dictate, that would be ideal.
All right. They're on my roadmap.
Okay, perfect.
You've got your assignment there, Jared.
I did.
Well, we want to thank all of our panelists here and our sponsor, Nuance, for making today's program possible. And we want to thank everyone in the audience for joining us. And we hope you'll join us in the future for another healthcare innovation webinar. So that concludes today's presentation. Thanks.
Thank you very much. Bye-bye.
Bye.